Hello, wonderful autism community. This is Farah Danish, your autism family coach. I'm on a mission to bring the latest information to keep my autism community up to date on this overwhelming journey of autism so that you can take the right steps that are needed for your child at the right time. Today, we have an interesting topic. It's called primitive reflexes. Now, what are primitive reflexes? Have you ever wondered about those automatic movements that babies do, right? And not only when they're in your hands, when they're physically in your hands, but even in utero, when they're in your womb, you see these movements that they're always moving. They're sucking, they're kicking, they're waving, they're doing all those movements, even in the womb. Now, these movements, they serve a purpose. These are called primitive reflexes. They're involuntary movements and they're called primitive reflexes, and they're there for a purpose. They're nature's way of ensuring survival and early development. And it's inbuilt in the brainstem, right, of the baby. It's also a way for the baby to understand and orient itself to its environment. Like, for example, I want you to picture a newborn baby. When you put your finger on their palm, you will find them grasping your finger. That's a reflex. Now, these involuntary movements, like I mentioned earlier, they are rooted in the brainstem, but they're also essential for future learning. They are stepping stones for our babies, for their future learning, for their future motor coordination learning. Because let's face it, any learning that's needed or that's required, there is a physical skill, a physical aspect to learning, whether it's reading, writing, learning a sport, even being able to sit at a desk. There are physical skills needed for that. Now, these physical skills are acquired through these reflex movements that babies exhibit as young as, 1 month or 2 months. They have to be repeatedly practiced all the time. And the sensory integration of the mind and the body is also developed at that time. And what is sensory integration of the mind and the body? It's the ability to perceive the internal and external threats in the environment, which the child goes through with their five senses. Now, next, what are the benefits of this primitive reflexes? Now we understand how and why they're so important. The benefits of this is pretty self-explanatory when you think about it. These primitive reflexes are the child's, survival tools in their first year because there's very little else that they can do. They help the baby through the birthing process. There's a lot of movement required of the neck. Their neck has to be strong, sturdy, and all, their other limbs have to be pretty strong to help them push through the birthing canal. It also helps them with taking their first breath, filling their lungs up. It's a whole process. And these reflexes help with that. They also help them with moving away from hazardous stimuli, to suck, to swallow, to kick, to wave. These are the benefits of these primitive reflexes. Now here's the kicker, the best part. Well, this is the part that should interest you, to be honest. These reflexes that the child acquires in utero should naturally integrate by 12 months or 1 year. The child should be growing out of these integrated movements. So they have to be integrated by the age of, by 12 months or by 1 month, give and take. They should be integrated by then, and then it has to be phased out. When these primitive reflexes are still active in the child's body, when they actually should be inhibited, they are then called retained primitive reflexes. So when you go to an occupational therapist or anyone who's familiar with the whole concept of primitive reflexes, and when she points out that your child has certain retained primitive reflexes, that's what it actually means. Now, what happens is when these reflexes are retained, They cause involuntary movement that then go and cause faulty learning processes. In simple terms, the baby will continue to grow, but they will perceive their environment in an immature way. They will react in an immature fashion. Our autistic kids don't interact with the environment in an age appropriate manner. That's when behavioral challenges follow. Emotional regulation challenges, meltdowns. Those are the kind of challenges we start seeing. One of the challenges we start seeing when primitive reflexes are retained. And they cause disruptions in other areas as well, in motor skills, in sensory processing, in emotional regulation, like we just discussed, and even cognition. So that's what happens when your primitive reflexes are retained. And what are those reflexes? I'll quickly go through some of them with you, and I'll cover the rest of them in my next episodes, which is specifically for primitive reflexes. These are the reflexes: motor reflex, rooting reflexes, palmar reflex, asymmetrical reflex, tonic reflex, spinal gallant reflex. That's a mouthful. The sixth one, so I'm just going to go with TLR. And the seventh one is also a mouthful, so I'm going to go with STNR. And I'm going to be talking more about this in detail in my next episodes that I'll be focusing on. And I will be working my way up from what are the foundational things your child needs to know and have acquired for any kind of learning to happen. All right. There also has to be an emotional readiness, a behavioral readiness for learning to happen, like I said. So it's not just the physical learning. So after that, then comes brain gym, and I'm going to mention all the details about how brain gym is important for learning to happen. And then we're going to work our way up to OT, and then taking up a sport or any other, academic learning to happen. So all of these are foundational stepping stones your child needs to learn, acquire, before they move to the next level and then the next level. Because if you miss out on these, that's when your child continues to struggle. And you'd rather help them here so that they become independent learners than constantly making accommodations and modifications for them to make the whole learning process easier. I hope this episode was helpful for all of you. Do like, do subscribe, and share if there is anything more that you'd like to hear on not only just primitive reflexes, on any other topic pertaining to autism. Please do let me know. I look forward to hearing from you and providing more information. This is Farah Danish, your autism family coach. Take care and God bless.